Now it's time for On Point, where we speak to experts to delve deeper into the biggest news stories in the spotlight right now. South Korea's new daily COVID-19 cases remained above 350,000 for the second straight day Sunday, as the country is still being slammed by Omicron.
On Saturday, the daily tally hit a record high for South Korea of over 383,000 new infections. And on top of that, the number of critically ill patients is due to exceed 1,000 for a seventh straight day on Monday. For more on where South Korea stands in terms of COVID-19, we connect to Dr. Alice Tan, internist at MizMedi Women's Hospital. Good morning, Dr. Tan.
Good morning.
So the prediction models were forecasting the maximum number of daily infections to top out around 350,000 by the end of March, but it's already exceeded that on Saturday. So given the exponential spread, do you expect the number of new infections to start plateauing out soon?
Well, I think we may be near the peak, but not beyond the peak. And the reason why I say that is because the test positivity actually increased yesterday from 51% to 55%. And we need to see test positivity start to go down before we can predict that we are beyond the peak and on our way down. Now, the other reason why I think is because of our home care policy now for the majority of patients, including more than 200,000 children. We have 1.5 million people in home care. And just the way that homes are structured, of course, in Korea, it's nearly impossible to completely isolate a potentially also with the large numbers of children at home, this almost necessitates that there will be at least one caregiving parent who is also eventually diagnosed with COVID. So we have the situation now of home care of more than 1 million people. We have, of course, the innate high population density of our society. We have the high transmissibility and the immune evasion properties of Omicron. And then, of course, we have the low stringency of our public health and social distancing measures right now. So it does look like that there is the potential that we may go even higher in terms of our daily cases this week.
Yeah, it really seems that way. The rising number of critically ill patients is also a cause for serious concern. We all know that there's a huge amount of cases right now, but considering Omicron is generally considered to be much more milder than previous strains, why do you think the number of seriously ill is rising so much? And also, do we know the makeup of those critically ill patients in Korea? Are they very elderly people, or are they a cross-section of age groups, but those with serious pre-existing medical conditions?
Yes, you're absolutely right. The vast majority of people who are in ICUs right now are age greater than 60 and have underlying medical conditions, but we should keep in mind that the absolute number of younger people in critical care has also increased as of late. And it's hard for people to understand, I think, why we have such a high number of people in ICUs now, because, as you said, at the very beginning, Omicron was touted as a relatively mild variant. But the mildness of Omicron only applies to a certain section of the population, not to everyone. And right now, the virus has taken advantage of its ability to infiltrate the high density of group residential facilities, such as long-term care facilities, skilled nursing facilities, nursing homes, convalescent hospitals, and also institutional settings for the care of people with disabilities. And it's really causing a lot of infections in that population. And for that population, the conversion to severe disease is much higher. At the beginning of the Omicron wave, the conversion was 8.3% in people aged over 60 years old. It has since gone down to 1.3%, but because the denominator has grown so high in terms of the transmission rates are being so high, that's what's leading to an increase in people in ICUs.
But Dr. Tan, even though much of the population have been vaccinated, there are still some people who couldn't and who haven't been vaccinated yet. So if you get Omicron and haven't been vaccinated, is it certain that you will have worse symptoms than someone who's fully vaccinated? And if so, what kind of symptoms could be different from those who are vaccinated?
Well, we know that for the entire population, so for everyone, overall, the conversion rate to severe disease, primarily we're talking about COVID pneumonia, is 0.06% if you've been fully vaccinated. And for fully vaccinated, I mean having gotten your third dose. However, for a person who's not been vaccinated at all, the conversion rate for severe disease goes up by 40-fold. To 2.37%. So for a person who has not been vaccinated against COVID-19, even if you're infected with Omicron, your symptoms can be quite severe with high fever, sore throat, cough, and then the most worrisome symptom would be conversion to COVID pneumonia.
Okay, unfortunately, Dr. Tan, we are out of time, but as always, we're grateful for your knowledge and your insights, and we hope to speak to you again soon, hopefully under better circumstances.
Thank you.
Thank you.